Allow me to reintroduce myself.
It's your favorite Dr. Harry. Welcome back, ladies and gentlemen, and for those who are seeing this for the first time, my name is Harry, and today I'm going to deconstruct a misconception about diabetes. Many people say that eating a lot of sugar causes diabetes. Is it true? Medical evidence has shown that getting fat, regardless the amount of sugar intake, increases your risk of developing diabetes, especially those who are genetically susceptible. But still, eating a lot of sugar or too much sugar is unhealthy. It provides nutrition and also puts you at a risk of obesity, which is a risk factor of diabetes, especially diabetes type 2. Another misconception is that people with diabetes hunger for sugars. In reality, though, they may have same desires for sweets as most others. If not controlled, diabetes can lead to hunger, but not necessarily hunger for sugars. So people with diabetes can eat sweets, but they must factor their sugar intake into their diet plan. So I'm going to help you understand what really diabetes is. The term diabetes mellitus is derived from a Greek word which means to siphon, and a Latin word which means sweet like honey. So these two terms describe this disorder. For water passes through the person who has diabetes, it's like the water is being siphoned from the mouth through the urinary tract and outside the human body. I hope you guys did some experiments in physics, like you fill water in a tank, take a pipe, insert it in, and suck some water from the tank, which is siphoning, and then the water will run continuously without needing a water pump. So this is what is happening here. Glucose has high osmotic pull, so it means that they will lose a lot of water. So the increased thirst or polydipsia they normally experience is for them to take in water to help flush out the excess glucose. Furthermore, the urine is sweeter with sugar. In fact, prior to discovery of more efficient techniques, one test for diabetes was taking the patient's urine and pouring it on an anthill. If the urine attracted ants, this indicated the presence of sugar in the urine. So that's how diabetes used to be tested for before the invention of these techniques that we have right now. There are two main types of diabetes. There's diabetes type 1 and there's diabetes type 2. And I'll break them further. Diabetes type 1 is further broken down into type 1A and type 1B. Type 1A is autoimmune, which means that the body cell attack the pancreatic cells that produce insulin. And then type 1B, it doesn't show or it doesn't have any connection with the autoimmune. We call this idiopathic. When I say idiopathic, I'm not calling you idiots. It just means that there's no known cause of this type of diabetes. Diabetes type 1 is also called juvenile diabetes or insulin-dependent diabetes. It's called juvenile because it can also occur in children. The peak age for being diagnosed with diabetes type 1 is 13 years or 14 years and above. But it can occur in some people when they are much younger than this age. Why is it called insulin-dependent? I want you first of all to understand this. In a healthy person, after eating a meal, the pancreas responds to the increase in amount of glucose content in blood by releasing the right amount or proper amount of insulin. So insulin binds to muscle cells and other cells in the body, thereby activating the portals that allow glucose inside the cells. So insulin acts like a key that lets, or the key that opens in order for glucose to enter the cell. So muscle cells and other cells absorb the glucose and burn it. As a result, glucose levels in the bloodstream return to normal. So in diabetes type 1, these individuals don't have this ability. Why? Because the immune cells have attacked the pancreatic B cells that secrete insulin. Therefore, no insulin is secreted. So without the assistance of insulin, glucose cannot enter into the cell. What is the aftermath or what is the result? Glucose ends up building up in the bloodstream, thwarting vital processes and also damaging vessels. Then you also have diabetes type 2, which is also called adult onset or insulin independent. Why is it called insulin independent? Insulin is available, the pancreas is producing the insulin. So the problem is that insulin receptors on the muscle cells and other organs are dysfunctional. They are rejecting insulin. So the portals that need to be activated to allow insulin into the cells will not be activated. What will ensue? You guessed it right, glucose build up in the bloodstream, thwarting vital processes and damaging vessel walls. We said diabetes type 1 is mainly as a result of autoimmunity, which is different with diabetes type 2. With type 2 diabetes, the genetic factor is even stronger. So researchers and scientists are studying the relationship between genetics and obesity, as well as the way excess fat seems to promote insulin resistance in genetically susceptible people. Why is diabetes type 2 also referred to as adult onset? Is because this type of diabetes occurs in people who are 40 years of age and above. But recently, diabetes type 2 is becoming the disease of the young. 20 years ago or 10 years ago, they used to teach medical students that the average onset of diabetes type 2 is 40 years. But nowadays, it's being seen even in children as young as 10 years old. But why the increase in diabetes among the youths? Sometimes a genetic predisposition is involved, but weight and environment may also play a role. The number of obese children has doubled in the past 2 decades. What accounts to this? According to the FDA, there have been a number of changes in food habits and activity patterns over the past 2 decades. This include increased reliance of food consumed outside the home, increased rates of skipping breakfast, increased consumption of soft drinks and fast foods, and also reduction of physical education in schools and elimination of rest in schools. During my high school and primary school studies, we used to have a session on our timetable called PE, Physical Education. I don't know if you still have such programs, but if you're a student watching this, please, if you don't see PE on your timetable, talk to your teachers and tell them to include PE on your timetable. It's very important. All work without play makes Jack a dull boy. I don't know if this applies in this case, but I think it applies. So these factors may have led to the increase in number of diagnosis of diabetes type 2 in youths or younger people. Then there's diabetes type 3, which is not formally recognized as a type of diabetes, but it's a type of insulin resistance that occurs in the brain, otherwise known as Alzheimer's. So what are some of the signs and symptoms of diabetes? You'll have frequent urination, increased thirst, increased hunger, blurred vision, fatigue and weakness. You'll have irritability and other mood changes, frequent infections, and also poor wound healing. It may cause cataracts, may destroy some important nerves of your eye, especially the optic nerve, damage to blood vessels in the retina. We call this diabetic retinopathy. May cause kidney damage, which we call diabetic nephropathy. May cause damage to your nerve endings, which we call diabetic neuropathy. And also may jumpstart the electrical system in your heart, which we call autonomic neuropathy. Another important symptom that I was almost forgetting is darkened areas of your skin, especially at the back of the neck. We call this acanthosis nigricans. So if you notice these symptoms, it's time for you to go and see a doctor. Treatment of diabetes can be particularly very difficult because someone can have this disease without them knowing, because at first these symptoms are usually mild. So diabetes often goes unrecognized, hence it has been dubbed the silent killer. So when you see a doctor, depending on the type of diabetes, you may be put on insulin or anti-diabetic medication, and also proper diet and exercise is essential for diabetes patients. Many patients with diabetes must supplement their diet and exercise program with daily testing of glucose levels along with multiple insulin injections. As a result of improved health through good diet and a good exercise program, many patients with diabetes type 2 have been able to discontinue insulin therapy, at least for a time. What about those with diabetes type 1? There's a certain article I read. One patient said that with a good exercise and diet program, she has been able, or there has been increased efficiency in the insulin that she injects. So folks, diet and exercise is very essential or vital for diabetes sufferers. Physical experts recommend at least 30 minutes of moderate physical activity on most, if not all, days of the week. This can include something as simple as walking. It's probably the best, safest and least expensive form of exercise. You do not need any athletic skills, a good pair of shoes, and you're good to go. It will be good for you to work with your doctor who will take you through your exercise program, especially for those who have diabetes complications. The reason why exercise in this type of patients should be professionally supervised is that diabetes can damage the vascular system and nerves, thus affecting blood circulation and feeling. Hence, a simple scratch on the foot may go unnoticed, get infected and turn into an ulcer, a serious condition that may lead to amputation if not treated immediately. Still, an exercise regimen can help one to manage diabetes. The more researchers study the benefits of regular exercise, the better the news they get. Above all, take care of yourself. Diabetes is a disorder of the very engine of life, and follow the course of treatment that your doctor puts you in. If you don't take care of yourself, some vital mechanisms may fail. Sometimes they may occur with life-threatening consequences. So people don't die directly from diabetes, they die from complications. We do a good job in preventing the complications, but a poor job once they occur. There is no diabetes that is not bad, it's all serious. So therefore it's wise to follow an advice from one teenager sufferer who simply states, stay away from junk foods and stay fit.